Boa tarde. Good afternoon. I'm Dr. Gregory Ginsberg from the University of Pennsylvania in Philadelphia, and I'm the current president of the American Society for Gastrointestinal Endoscopy. And welcome to you from beautiful, sunny San Diego, California, where we're just concluding the Digestive Diseases Week, or DDW 2012. This was really quite an exciting meeting for gastroenterologists and particularly for gastrointestinal endoscopists. Among the highlights clearly were the ASGE postgraduate course with its new two-day format, the program this year entitled Integration of Science and Practice use a variety of innovative formats to discuss common and not so uncommon disorders involving the esophagus, the gastroduodenum, the colorectum, and the pancreaticobiliary systems. Another highlight, clearly from my standpoint, was the ASGE's presidential plenary session, which took place on Monday afternoon. This involved a series of presented papers intermixed with illustrative video presentations, and each segment then brought home with a state-of-the-art lecture. Among these highlights were several papers and a video presentation on the POEM procedure. POEM, standing for per-oral endoscopic myotomy, is a new and innovative endoluminal therapy for patients with achalasia. This very exciting new approach to the disease is gaining quite a bit of momentum and is a great opportunity for gastrointestinal endoscopists in as it deploys techniques that we have developed for advanced therapeutic endoscopy, including the ESD techniques. The next section involved interventional endoscopic ultrasound. Endosonography has matured as a diagnostic tool, but it's really beginning to flex its muscle as a vehicle by which we can perform directed therapies. And so, again, several video and paper presentations reviewed tools and techniques and successes in using EUS as a means to achieve pancreaticobiliary therapy in circumstances where the ampulla is otherwise not accessible. Some very fascinating papers were presented pertaining to enhanced aspects of mucosal imaging, particularly some new technology that looks at vessel size and oxygenation levels in tissue surrounding tumors, with the prospects of being able to diagnose the likelihood of tumors by contact tissue information acquisition in neighboring, otherwise healthy appearing tissue. Perhaps one of the most exciting and important papers that were presented during the presidential plenary in all of DDW was the paper that was a randomized multicenter trial looking at per-rectal indomethacin as a means to reduce the risk and severity of ERCP-related pancreatitis. This paper has recently been published in the New England Journal of Medicine and provides really new knowledge that is expected to change the way we practice and certainly will benefit our patients. So those are some of the highlights of DDW, certainly from the standpoint of gastrointestinal endoscopists. And I'm sorry you weren't able to make it this year, but we hope to see you in Orlando next year. I would also make mention of two items that should be of interest to all Brazilian gastroenterologists. One is that the ASGE will be actively participating with you in this year's Pan-American Congress, where we will be co-hosting a postgraduate course for the program in Panama in November. So we hope to see many of you there. And lastly, I draw your attention to the ASGE's campaign to develop our Institute for Training and Technology. This is intended to become the global home for endoscopy, and we really want our international, particularly Brazilian members, to familiarize themselves with this institute. It will be a tremendous opportunity for international members to come and train in new techniques and new technologies. So, happy DDW. Bye.